Let me start with a number that should shock you. The average cost of having a baby in the United States is nearly $19,000 for an uncomplicated vaginal delivery. For a C-section, it is over $26,000. That is not including prenatal care, ultrasounds, or the pediatrician visits after birth. And here is the part that makes it even worse. Most health insurance plans sold on the individual market do not cover maternity care at all. Before the Affordable Care Act, nearly 2/3 of individual plans excluded maternity. Under the ACA, all marketplace plans must cover maternity and newborn care as an essential health benefit. But millions of Americans are still on plans that are not ACA compliant. They are on short-term plans, association health plans, or grandfathered plans. They think they are covered, they are not. And they find out when they get that first bill. By the end of this video, you will understand exactly how maternity coverage works, which plans are useless, and what you should buy instead. I will break down the ACA rules, the gap in short-term plans, and the specific options for self-employed, freelancers, and people who are planning to start a family. I will also cover the UK and Canada, where the system is completely different. Whether you are trying to conceive or just want to be prepared, this video could save you from a $20,000 surprise. Let me start with the most important fact. Under the Affordable Care Act, all qualified health plans sold on the marketplace must cover maternity and newborn care. That means the plan must cover prenatal visits, labor and delivery, postnatal care, and well baby visits. There are no annual or lifetime dollar limits on these services, and you cannot be denied coverage or charged a higher premium because you are pregnant. That is the law. So if you buy a plan through healthcare.gov or your state marketplace, you are protected. But here is the pattern interrupt that most people do not know. The vast majority of health plans sold outside the marketplace do not have to follow these rules. Short-term limited duration plans, which are popular because they are cheap, almost never cover maternity care. A study found that more than 90% of short-term plans exclude maternity coverage entirely. The few that do cover it have waiting periods of 12 months or more. That means if you get pregnant after buying the plan, you are not covered. Some plans also exclude newborn care. Your baby is not covered at all for the first 30 days. You are responsible for all costs. The same is true for healthcare sharing ministries. These are religious organizations where members share medical bills. They are not insurance. They are exempt from ACA rules. Most do not cover maternity at all, or they have strict rules about marriage and the circumstances of conception. Do not rely on a healthcare sharing ministry for maternity coverage. So what should you buy instead? The answer is simple. If you are planning to get pregnant, you need an ACA compliant plan. That means a plan from the marketplace. You cannot wait until you are pregnant to buy it. Open enrollment is from November 1st to January 15th. If you miss that window, you cannot buy a marketplace plan unless you have a qualifying life event like losing other coverage, getting married, or having a baby. But if you are already pregnant, that is not a qualifying life event. You cannot buy a plan after you are pregnant. The only exception is if your state has a year-round open enrollment or a special program for pregnant women, but those are rare. You must plan ahead. Let me break down the costs. Even with an ACA plan, you will still have out-of-pocket costs. Deductibles, copays, and coinsurance apply. The average out-of-pocket cost for a vaginal delivery in 2026 is around $3,000 to $5,000 for someone with a silver plan. That is a lot, but it is far less than the full cost. For a C-section, out-of-pocket can be $5,000 to $8,000. You can lower these costs by choosing a plan with a lower deductible, but that plan will have higher monthly premiums. You need to do the math. Now, here is the advanced strategy. If you are planning a pregnancy and you have a high deductible health plan, you can use a health savings account to save for your delivery. You can contribute pre-tax dollars and use them tax-free for all your medical expenses, including prenatal care and delivery. For a family, you can contribute up to $8,300 per year to an HSA in 2026. If you start a year before you plan to conceive, you can have over $8,000 saved by the time you give birth. That covers most of your out-of-pocket costs. What about midwives and birth centers? ACA plans must cover these as well, but the network may be limited. Check your plan's provider directory. If you want a home birth with a certified professional midwife, coverage varies by state. Some states require plans to cover them, others do not. You may need to pay out of pocket and then seek reimbursement. Always call your insurer before you schedule. Now let me talk about the UK and Canada, because the system is radically different. In the UK, the National Health Service covers all maternity care. That includes prenatal appointments, ultrasound scans, labor and delivery, postnatal care, and midwifery visits. It is all free at the point of use. You do not need insurance. You do not need to worry about deductibles or networks. You simply register with a GP and they refer you to maternity services. The NHS also offers free breastfeeding support and home visits after birth. If you want private maternity care, you can pay for a private room or a private midwife, but the core medical care is free. The only cost is prescription charges for any medications, but those are capped at about £10 per item. If you are on low income, you can get free prescriptions. In Canada, the system is similar. Each province covers medically necessary maternity care through the provincial health plan. In Ontario, OHIP covers prenatal visits, ultrasounds, delivery in hospital, and postnatal care. In British Columbia, MSP covers the same. You do not pay out of pocket. You do not need private insurance for the delivery itself. However, private insurance may cover things like a private room in a hospital, which is not covered by the province. Some provinces also cover midwifery services. In Ontario, midwifery care is fully covered. You can choose a hospital birth, a birth center, or a home birth with a registered midwife, all covered. The only gap is that some private ultrasound clinics may charge a fee if you want a non-medical 3D ultrasound. But for core care, your provincial health card is enough. So for viewers in the UK and Canada, the answer is simple. You do not need special maternity insurance. Your public system covers it. The only reason to buy private insurance is if you want extra amenities or faster access to certain specialists. But for the birth itself, you are covered. Now let me give you a real-world example from the US. A couple in Colorado planned to have a baby. They knew they needed ACA coverage. They enrolled in a Marketplace Silver plan during open enrollment. The plan had a $3,000 deductible and a $7,000 out-of-pocket maximum. Their monthly premium was $650. They opened an HSA and contributed $300 per month. Over the course of the pregnancy, they paid for prenatal visits and ultrasounds out of pocket using their HSA. The delivery was a C-section, which cost $30,000. Their insurance covered all but $6,000, which was their out-of-pocket maximum. They paid the $6,000 from their HSA. Their total out-of-pocket for the year was $9,000, including premiums and medical costs. Without insurance, they would have paid $30,000. Their ACA plan saved them $21,000 in a single year. Now let me tell you a cautionary tale. A couple in Texas bought a short-term plan because it was cheap. They did not read the fine print. The plan excluded maternity coverage. The wife got pregnant. The insurance company refused to cover any prenatal care or the delivery. They had to pay over $20,000 out of pocket. They tried to switch to an ACA plan during open enrollment, but the baby was due before the new plan would start. They were stuck. That one decision cost them their savings. So, what should you do right now if you are planning a pregnancy? Here is your action plan. Step 1. If you are in the U.S., check your health insurance. Is it an ACA compliant plan? If not, switch during open enrollment. Do not wait. Step 2. If you are self-employed or unemployed, go to healthcare.gov and shop for plans. Look specifically at silver plans. They have lower out-of-pocket costs for lower-income families. Step 3. Open an HSA if you have a high deductible health plan. Start contributing monthly. Step 4. If you are in the UK or Canada, you do not need special insurance. But check that your provincial health card is valid and up to date. Step 5. If you are considering a short-term plan or a healthcare sharing ministry, do not. They will not cover your maternity. Let me also address adoption and surrogacy. ACA plans typically do not cover adoption-related medical expenses or surrogacy. You may need separate coverage or a rider. Some employers offer adoption benefits. Check your policy. Let me recap the key takeaways. Number 1. Most non-ACA plans, including short-term plans and healthcare sharing ministries, do not cover maternity care. They are useless for pregnancy. Number 2. Under the ACA, all marketplace plans must cover maternity and newborn care as essential health benefits. Number 3. You must enroll in an ACA plan before you become pregnant. Pregnancy is not a qualifying life event. Number 4. You will still have out-of-pocket costs, including deductibles and coinsurance. Use an HSA to save for them. Number 5. In the UK, the NHS covers all maternity care for free. In Canada, provincial health plans cover all medically necessary maternity care. Number 6. If you are planning a pregnancy, the cheapest month to deliver is January. Why? Because you will have met your deductible for the entire year and all subsequent care will be covered. Number 7. Never rely on a short-term plan for maternity coverage. It will fail you. Number 8. The best time to plan your pregnancy is before open enrollment. Get covered before you conceive. Here is what I want you to do right now. If you are in the U.S. and thinking about having a baby, open a new tab. Go to healthcare.gov. Enter your information and see what plans are available. Look for the words maternity and newborn care in the summary of benefits. If you already have a plan, pull out your policy and search for maternity. If it is not there, you are not covered. Start shopping today. Open enrollment ends January 15th. Do not miss it. If this video helped you understand why most maternity plans are useless and what to buy instead, hit the like button. It helps more people avoid a devastating financial surprise. Subscribe and turn on notifications so you do not miss my next video, which is called The One Thing You Must Do Before You Get Pregnant, according to a health insurance expert. And comment below, have you ever had a baby with or without good maternity coverage? Share your story and your country. I read every comment. Thanks for watching. Now go protect your future family. See you in the next one.